Hello, I am Jessica Webb at the Center for Research and Education on Violence Against Women and Children at Western University. I am a white and English and Irish settler with shoulder-length brown hair, large black glasses, and a light blue shirt on. On behalf of the Knowledge team, welcome to the Knowledge Hub Presents. The Knowledge Hub Presents series features information on trauma and violence-informed research and practice developed by members of the trauma-informed community of practice in their work related to preventing and addressing family violence. We acknowledge that Western University is located on the traditional lands of the Anishinaabe, the Haudenosaunee, the Lenape-Wauk, and the Attawandaron peoples, on lands connected to the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Wampum. With this, we respect the long-standing relationships that Indigenous nations have to this land as they are the original caretakers. We acknowledge the historical and ongoing injustices that Indigenous peoples, First Nations, Métis, and Inuit endure in Canada. We accept responsibility as a public institution to contribute towards revealing and correcting miseducation, as well as renewing respectful relationships with Indigenous communities through our teaching, research, and community service. We are happy to be joined today by Drs. Marilyn Ford-Gilbo, Colleen Varco, and Kelly Scott-Story. Dr. Marilyn Ford-Gilbo is a distinguished university professor and Women's Health Research Chair in Rural Health with the Arthur Labatt Family School of Nursing at Western University. With a background in public health nursing, for the past 25 years, her research and community work have focused on improving the health and quality of life of people affected by violence and inequities by improving services and policies. Dr. Colleen Varco is a professor emeritus at the University of British Columbia School of Nursing. Her work aims to decrease inequity and violence, including interpersonal and structural forms of violence, such as racism and poverty. Dr. Kelly Scott-Story is a health researcher and professor in the Faculty of Nursing at the University of New Brunswick. She is the Director of Community Research, Scholarship, and Teaching at the Fredericton Downtown Community Health Center and is a research fellow with the Muriel McQueen Ferguson Center for Family Violence Research. Her program of research is broadly in the intersection of violence, gender, and health, and focuses on the health interventions and measurement of violence, scale development, and community action. And with that, I will turn it over to the three of you.
Wonderful.
Marilyn's muted.
Wonderful. Thank you so much for this opportunity to get us started here today and for the chance to talk to you a little bit today about the iHEAL app, a new resource that we've developed to support women who have experienced intimate partner violence. We'd like to acknowledge, first of all, that we're grateful for funding that has supported this work and comes from the Public Health Agency of Canada. And also, of course, to offer our sincere thanks to the many research staff, students, people who provide direct services, colleagues, and violence survivors who've really given generously of their time and their expertise to help us develop and refine this app. We have three goals for you today, three primary goals. One is we'd like to introduce the app to you and a little bit about the research behind it. The second is we'd like to do a live walkthrough so that you can get a sense of its features and how to navigate it. And then finally, we'd like to talk about how it might be useful to you, either personally or in the work that you do. This is going to take about 30 minutes, and then there'll be a chance for question and answer at the end. So our team, just to acknowledge as well, comes from many different places in Canada. We work on a diversity of lands, primarily in BC, Ontario, and New Brunswick. And we also just wish to acknowledge the First Peoples who have stewarded those lands and our collective obligation to mitigate the ongoing colonial violence against those people and the lands. So, you know, there's so much conversation these days about the notion of intimate partner violence, and lots of declarations across the country really speaking out against this and thinking about it as a public health epidemic. And this is an important issue that's happening in our communities, and people are understanding now how common this is, that more than 40% of Canadian women experience intimate partner violence at some point in their lives. And it's such an important issue in part because the impacts are so broad and often long-standing. We know, of course, that IPV affects women's physical and emotional safety, and it can be lethal. And so a woman in Canada is killed by an abusive partner every 6 days, which is really a sobering statistic. But of course, the fallout of violence, it affects women's safety and many other things. And these things are all connected. So it affects women's health and well-being, their economic situations, their relationships, their families, their children. And again, these effects can persist over time, including after a woman has separated from an abusive partner. We also, of course, understand that that IPV is experienced by women from all backgrounds, but women who face systemic barriers and inequities, such as women who live with a disability, women living in rural communities, or Indigenous women face greater risks and often have fewer options to deal with the violence. So, you know, we're coming at this understanding this is a complex human rights and public health epidemic that requires actions on many different levels. So what to do about this? Well, in spite of all of this context, we know that women experiencing violence are trying to resist that violence in so many ways and still face a lot of barriers to getting support. And these are some of the barriers that women experience. They're things that won't be a surprise to you. I'm sure in your own experience and work, things like stigma and shame related to the violence, fear of reprisal from the abusive partner, fear of not being believed, mistrust, often from services and often for very good reasons, geographic barriers, and, for example, just not knowing where to start or what to expect. And so our work with online applications really points to the fact that when these are well developed, they can be a helpful, low barrier resource for women experiencing violence. And this includes women who may be dealing with the violence on their own or facing some of these or other barriers to support. So our team has been developing and testing apps for women experiencing violence for more than 10 years. The iHEAL app is actually the third in a series. It draws on more than 20 years of research that includes consultations with women experiencing violence and people who support them. And for us, it's a way of mobilizing some of the knowledge from our research into a very practical resource. The very first app that we developed was called I Can Plan for Safety. And it was an app that provided a personalized action plan for women focused primarily on safety and health and a few other issues. And we tested it in our research in a randomized controlled trial, a type of experiment, with 462 Canadian women. And we found in that study that there were benefits to women from using this online tool. So the benefits included things like improved mental health, more confidence in being able to do safety planning, a greater sense of control, something that's really important for women's healing, and less coercion from their partners. And that was a year after they first used that web-based app. Women also told us that they were able to use the app safely and that it fit with their needs. And 95% of them said that they would recommend it to another woman. And for us, that's kind of the litmus test of it being helpful in a lot of ways. And so some of the things that women told us in that study, you'll see here, their comments that came in qualitative interviews. And They speak to the idea that the app was safe, non-judgmental, empowering, and impactful. And we want to reinforce the idea that, of course, apps are never going to be a substitute for high quality services or community support, but they can be a very helpful tool. They can provide information and support to help women decide on the path that's right for them. And, really, knowledge is power. They can also be a helpful resource for family members or friends, or for people providing direct services, which we're going to talk about in a little while. And so just pointing to understanding where we've come from in this app and looking at what you're going to be seeing in a minute, these are the aims that we had. This is what we are holding ourselves to. We understand that women's needs, priorities, and their situation can differ, that apps need to be designed so that they fit with these differences. And so the process took 2 or more years, truthfully, building on our earlier work, but also drawing on ideas like trauma and violence-informed care, cultural humility, and harm reduction. And our intention is that this app is inclusive and appropriate for women of all backgrounds. But we tried to do this in a really careful way, not reinforce stereotypes or stigma experienced by women from specific groups. So, for example, the process took so long because we vetted every image, every sentence, every resource looking for biases. And we've gone through a process of consulting and inviting feedback, and we continue to do that because we know that this app will need to continue to evolve over time. These are the other design aims. They're things that won't be a surprise. Prioritizing women's safety and privacy. It's woman-led. We want the woman to feel in control of her experience and have complete choice in how she uses it. The messages are designed to be inspirational, hopeful, and affirming, and very practical, an orientation to tips and resources. Importantly, this was designed for women who are questioning their relationship, they have an uneasy feeling, as well as women who are in an abusive relationship, have named that relationship and are trying to decide on their next step, and women who left an abusive partner even years before, but are still living with the fallout of the violence. And it's intended to complement existing services. So, sort of like a one-stop resource is to help women link to different services and resources in their province and territory. So if you've gone and looked at the app and downloaded it, you will have seen this screen. This is our website, iHEALapp.ca. And this is where you can go to either access the web app or get a link to one of the mobile app stores. And this is a hybrid app that is both mobile and web-based, in part because we are being very intentional about trying to reduce as many access barriers as possible for women, understanding that not everybody has a mobile phone or access to internet. And so that was done quite intentionally. And you'll see here on the top the English and French options for the app. It's fully Canadian content, and the website provides lots of other information that's really helpful, including under the Safe Use tab, some good tips about safety and privacy when using the app so that women can decide whether it's right for them. So without further ado, we're going to introduce the walkthrough. Kelly will do the walkthrough of the app, and I will turn it over to her.
Thank you, Marilyn. So my name is Kelly Scott Story, and I will be taking you on a live walkthrough and demo of the app for the next few minutes. So I'm just going to stop sharing my video and start sharing my screen. Perfect. Okay, so this screen is our website, the iHEALapp.ca that Marilyn had just spoke about. If you go to the bottom, we're going to go into the app through the web app version. So I'm just going to click on the web app version. You're going to come to a login screen where if you've already created a user password, you can insert it here. We're going to create a new account. So at the bottom, create an account. The app is going to ask you to select your language of preference, English or French. I'm going to choose English for today. It's going to ask you to select your user type for yourself, to help a family member or friend, as a service provider, or for general use only. This information is just to help us improve the app by understanding different types of user groups that are accessing the app. It's not for any other purposes. So I'm just going to click for yourself and go into next. So next, select your province or territory, and that is so that the resources that are embedded in the app can be tailored to your specific area. So if you are living in Newfoundland, you're not receiving resources suggested to you from out in BC. So I'm going to choose centrally today. Even though I'm located in New Brunswick, I'm going to choose Ontario for today, and next. So the first screen here is a welcome message with supportive messaging on what the app is for, messaging around privacy and use. So you can click through the app. It's a personalized app for women's health, safety, and well-being. It's designed for and by Canadian women, and the information you provide is private and confidential. So now it's going to ask you to create your own password and user word. So I am just going to create one Daffy Duck, and I am going to want to make up a password. The username and password is only known to the user and must be remembered as it's not stored. So we do not want to collect any personal identifiers. We do not want to collect that information so that the app can remain confidential and anonymous. We want women to be confident in that. So the password should be 8 or more characters long. I acknowledge the terms and conditions. I can open up the terms and conditions here to read, and then I click next. So the next section of the app, and again, this is all called onboarding. So this is only seen initially when you enter into the app and register for the app, and then otherwise it's going to take you directly to the homepage when you put in your username and password from here on out. So just some messaging that the app is not for emergencies. In emergency, you need to access more appropriate services. If someone forces you to unlock the app, a woman can enter in 1234 as a password, and it will open up to a safe nondescript page. Right now, it's the weather page. Please remember your username and your password, as it's not stored in the app. And again, that's to protect women's confidentiality and anonymity. So to start the app. Okay, so this is the home page of the app. This is what we call the home screen. You will note up in the top corner, there's a little yellow flashing light, blinking light. This only shows initially, and again, it's part of the onboarding service. So if you click on the flashing yellow light, it will just say, here's your account. You can reset your password or delete your information here. It's going to show you where the home page is down at the bottom. You can save topics and resources here, which I will show you as I walk you through the app. And to leave quickly, there's a quick exit button at the bottom that will be available on every single screen that you can just click, and it will take you to a weather page. Okay, so this is the home page. I'm now going to switch over to another version here that I have already saved some information in. So the first thing you will notice is that it is organized into these 6 colored tiles or areas. We call them pillars or components. These are the areas that we know are important to women and that women typically address when they are in an abusive relationship, leaving, or have left an abusive relationship. So areas that are important to women are her safety, her basic needs, health and well-being, connecting safely, claiming your power, and family. Up at the top, you will see that there is a quote of the day. These quotes have been taken from women survivors of intimate partner violence, as well as from service providers and some of our qualitative research. So that quote changes daily, and it's just a supportive, positive message. You will see a little heart icon next to the quote, and when I click on that, it means I can actually save that quote. So if there's a particular quote that has meaning to me or that I like, I can save it. So the quote of the day, then if you go down to the scroll to the bottom, you can find a resource or a service. We have pinned some of the most pertinent ones just to the home page for women to see always, but then you can search. So for example, if I was to search housing, remember I am in Ontario. If I'm to search housing, affordable housing in Ontario comes up, Canadian mortgage and housing, and so forth, Ontario Aboriginal housing. And I can save different ones of these resources and pin them, and they will show up in the saved resource here at the bottom. So I have already saved this housing one, and I've already saved the Ontario Aboriginal housing one for later. Okay, so navigating through the app. So women choose an area of where they want to start first. You will notice that there's no predetermined start here, go here. It is truly woman-led. So a woman can choose what tile or what area maybe she wants to start in, or that meets her needs the most. So starting just at the top, I'm going to go into safety. You will notice that each of these pillars or areas are organized in the same way for ease of navigation and repetition. And they're also a distinct color, so you know which pillar you're in. So anytime things are this blue, you know you are in basic needs: housing, food, money, security, and so forth. So going into the safety tile first, again, see how the background is all this similar aqua color. It starts off with a supportive messaging, acknowledging that everyone deserves to feel safe in their relationships, but abuse robs women of feelings of that safety. Some definition of what abuse is, and then each of the pillars start with this reflective, or what we call a warm-up activity. So this one's called How's Your Safety? And it's about 1 to 2 minutes. It's a quiz to help orientate the women to this pillar. So if you go through, it tells you a little bit about what the questions are. Think about your sense of safety with your current and or ex-partner and answer these questions. So there's there's 5 questions in this particular warm-up activity. So how often do you feel afraid of your partner or ex-partner? Some of the time. How often do you worry about being physically or sexually harmed by them? Some of the time. How often do you try to avoid making your ex-partner or partner angry? Most of the time. How often do you feel owned and controlled by your ex-partner? Most of the time. And how often does your partner or ex-partner make you feel worried, uncomfortable, or unsafe in other ways? Most of the time. At the end of the warm-up activity, there is a tailored message that has an algorithm in the back that has been designed based on how the woman has answered the question. So feeling unsafe in some parts of your relationship seems to be a regular part of your life. Everyone deserves to feel safe. And then it points towards some of the activities or information topics within the safety pillar. So for this one is suggesting the danger assessment and explore the topics to learn about safety actions. I can redo this little quiz at different times, or I can just hit finish and it's going to take me back to the safety pillar. When I scroll down, there's going to be a list of topics here. And so these are all topics related to the pillar of safety. There will be topics with activities. So if you look at the right-hand side, there's the word activity next to ones that there's an activity embedded in, or ones that are just for information only. So for example, the danger assessment is the first activity. Many of you will be very familiar with the danger assessment developed by Dr. Jackie Campbell. Dr. Campbell is a colleague of ours, and we have permission to use the danger assessment within the app, as well as her scoring algorithm. So if you click on the danger assessment, you will see that there's a lot of people on the app right now, so it's loading a little bit slower than usual. That will be updated within the next few days. So with the danger assessment, introduction to the danger assessment, this one's specific for a male partner, what to expect by going through the danger assessment, and then it goes through each of the questions. And again, it's just loading a little bit slowly today. I'm not going to go through all 19 questions, but just to say at the end, it will present you with a tailored message based on your level of risk, or the level of risk the woman has put in. And that's really important, as women often underestimate her risk. It also has some suggestions around actions in the moment, depending on her risk, if it's severe risk, immediate risk, and so forth. So back down to some topics. So for information topics, there's also a power control activity, safety actions checklist, which is helpful in working with women. Sometimes service providers like to go through the safety action checklist to get a sense of what women have tried, what they would like to try, what they would like more information on. So if I look at information topics, for example, violence against women's services, I can click on this and it will load some of the violence against women's services in the area. Also some information about what is violence against women's services. What are these services? What should I expect if I call? What are the parameters around these services, shelters, and so forth? Things to consider. How can I find violence services in my area? So these are called accordion features. So I can click on it and receive a little bit more information around how to find violence services in my area. If I go down below, the resources now that are pinned are specific to this topic. So the resources on the home page were general resources to access. Now the resources in each of these topic areas are specific to what the topic is. So if I go back to the home page, I will move on to health and well-being pillar. So focus on health is extremely important and is often not dealt with in favor of crisis situations. So this page is set up the very same way as safety. There's supportive messaging that comes in, orientation to the app. There's a small little warm-up quiz around how is your health to help women start to reflect on her health and how she defines health. And then when you scroll down, there are topic areas, some with activities. Again, look at the right-hand side for activities. One is called Assess Your Health. And so that helps women go through and assess her current symptoms and take stock of her health and well-being. In the topic areas, there are some for information. For example, chronic pain. Chronic pain is a huge issue many women face. And so this starts off with supportive messaging around the link between abuse and chronic pain. And then you can go down to, again, these accordion type of features. What can you do about the chronic pain? And which will give you some tips and tricks around how to manage some of the chronic pain or things to think about. And then a resource specific to chronic pain, which is Live Plan B website. If I go back out, going into basics, so the basics pillar or area acknowledges that women need to have the essentials in life to thrive. So need to have basics met: housing, food, childcare, stable source of income, access to health care, and so forth. So set up the same. The background's blue. So how are you doing with your basic needs is a nice warm-up reflective activity to set the tone of how she feels she is doing in being able to meet her basic needs. The topic areas, as you can see, there's quite a few. Increased control over finances, relationships, legal options, food and supply, housing, and so forth. So if I go into the housing one, you will see some of the resources I showed you at the very beginning when I clicked on housing as one of the options. So just talking a little bit about what housing is, how to find housing, different types. So second stage housing, public housing, private rental. These are accordion, and then some resources related to housing. If I hit the back button up here, I can go back into legal options and go through and read about what are some of the legal options or things I need to consider if I'm considering a legal route. So applying for a peace bond, Canadian Council for Refugees, and so forth. So Family Court and Beyond guide from Luke's Place. And so if there's something of interest to me, I can click on these websites now, or I can save them in a save feature that will then allow me to go into my save feature in a few minutes and see these. So if I go back to my home page, Connecting Safely, which is the purple pillar, really focuses on supporting the woman to build positive relationships with others, including intimate relationships, social relationships, and relationships with service providers. So a little message about what connecting safely is about. Take a moment to take stock of your social and support networks, a little warm-up activity, and then topics that are connected to connecting safely. In here, there's a healthy partner relationship quiz that is really quite popular. It identifies red flags and provides a tailored message around any red flags that you are identifying when answering the questions for a new or existing partner relationship. How and when to share your story is really about more information. Guidance on how and when to share your story, what's appropriate from a trauma violence informed lens, and really encouraging women to always ask herself, what do I need to share? What do I want to share? And what do I hope to get out of a sharing? In order to help protect herself, women often overshare, putting themselves at risk because they're wanting to convince someone of the legitimacy of their experiences. So this is a bit of a caution of how to protect yourself, and then some resources. So claiming your power is support for her, taking care of her needs, herself, and pointing towards future goals. Often women experiencing violence are not able to prioritize themselves. And so this section of the app really focuses on that. Taking care of yourself is part of healing from abuse and planning for your future. So how are you doing taking care of yourself is a reflective warm-up activity to get her situated within this pillar. And then the topics include caring for yourself, managing and reducing stress, moving your body, grounding activities, personal goals and dreams, and spirituality. So managing and reducing stress, I might choose that one, go in and read some tips and tricks around how to manage stress, pay attention to your body. Again, these are all accordion type of features, how to move your body, and then some helpful resources. If I go back, grounding activities actually have some trauma violence informed type of videos that we have embedded and created in here that are really well done and that women enjoy. Go back to the home page and going into family. So family is safe and healthy family experiences, acknowledging that family can bring you strength, but also can bring you great stress and distress. So family is who you say they are and can be anyone. So again, situates around how abuse and violence can change your family in important ways and how it impacts your family. A little warm-up activity around what is your experience of family, and then topics related to family. So there's a shaping your family activity focused on what's important to you in family. Separation and divorce is another topic that is quite popular and provides some guidance around how to engage in separation and divorce. So there's legal issues to consider, support of family changes, tips specific for Indigenous women, issues for newcomer women in the topic of separation and divorce. And so there's important messaging that goes with that. And then again, the resources are specific to this topic area of separation and divorce. So if I go back out to the home page, those are just a really high level highlight of what is in each pillar. As you can see, there's a number of topic areas in there. So hopefully there's something to meet all women's needs. At the bottom, there's the save feature. So the great thing about this app is that as women use it and interact with it, it becomes more specific and tailored to her needs based on how she's interacting with it. So if I go into the saved feature, I can go into my saved quotes, which I have saved 2 quotes over the last couple of days that I thought were particularly motivating, and I really liked how they were worded. If I go into resources, you will see at the beginning I had saved the Ontario Aboriginal Housing resource and the Affordable Housing resource, so they're saved there so that I don't have to go all the way back through the app to find things that I saw and that I may have wanted to save and pull out. So it streamlines it and makes it more specific to me. So I can click on all these resources and they're right in my save page. topics, there's a few topics that I wanted to go back to. So the grounding activities, I wanted to watch those videos. And so they're saved right here so I don't have to navigate through the whole app. And this feature is actually a brand new feature, and it is saving the results. So the danger assessment I had done back on April 29th, and my results are here. Here's my score. My score is 26. Some tailored messaging that came as a result of how I answered the questions in the danger assessment. And so what this is useful for is service providers and women have both told us that they like to track their score on the danger assessment over time. And so every time I do the danger assessment, it will save it here with the date and with the score so that that tracking is available to me to watch any change over time. Similar with the safety actions, I can pull this here, look at the safety actions that I said I was interested in, as well as the messaging so that I can go back and do a check-in. This is a great feature for service providers as well to check in what is working, what isn't working. And then also my health. I had said these are the things, these are my current health issues and the messaging that came with it, but I can check back in or use this to sit with a service provider or a healthcare provider as a topic of discussion, or these are the areas that I'm struggling with my health in at this point in time. And it timestamps them, which is great for those tracking purposes. I will also say that we worked with Stitch Media to develop a content management system. So we have full control over the content updates. We can fix links. We can add or remove resources as appropriate. We have about 500 resources right now embedded into the app, and our team does the work to vet these resources. We have a team that makes sure that the links are working and that the resources are appropriate, and to make sure that they're still active. I will say that we have made a decision, or we try to prioritize national and provincial and territorial level resources, and that is simply because of stability. With over 500 resources embedded in the app, we want to make sure that the user has access to stable resources. There's nothing worse than clicking on a resource and the link is broken or the service is no longer in service. So we have really rolled it up to those more stable provincial, territorial, and national type of resources, acknowledging that they often know how to get women to grassroots resources within specific communities. And so if there are resources that you see that you think would be of benefit to adding to the app, please just contact us through the website. There's a contact us feature, and you can send us an email, and we would love to look for, again, ways to continually update and improve the app. So I will stop sharing my screen now, and I will hand this back over to Marilyn.
Thanks, Kelly. So I wanted just to say a little bit about how we hope services will use this app. First of all, in any setting where women are served, and this is based on research with women experiencing violence from partners of any gender. But so any setting that's serving women, we are hoping people will take a universal approach and make it available to all women. And, saying things such as, if you know anyone who is experiencing violence, please feel free to use this, pass it on to them. So in a way that doesn't require disclosure. And then in settings where the contact is brief and fleeting, maybe you're just a one-time opportunity to provide services to a woman. If there's some kind of a flag for violence, then it can be used in a variety of ways. Everything from offering the app and just making sure that the woman has access to it, to something that's a little bit more in depth, offering, for example, to go through something or pointing to a specific resource. And then finally, if it's in the context of an ongoing relationship, for example, counseling, what we found was women actually used the app with their service providers. So they things such as that they'd gone through a particular tool with their service provider, with their counselor. Other women actually also used it with their family and friends. With, for example, one woman telling us how she used it with her father, who really didn't understand her situation, and then she walked him through some of the tools to help him kind of get it better. Next slide, please. The as Kelly mentioned, the danger assessment is available, and so service providers have found useful is to help the women actually walk through their own danger assessment and then do safety planning. We have been really emphasizing health and well-being, and so there's all kinds of resources in there, for example, on managing pain, on dealing with depression, and so on. It's a way of sort of familiarizing women with services. And, you know, I think we mentioned that fewer than 17% of women who experience intimate partner violence actually access services. So we're hoping to better connect women with services that are appropriate for themselves. So I'm going to just quickly mention again that this is something that you can pass on to family and friends who often might feel at a bit of a loss as to how to be supportive. So we have, next slide, please, Kelly, when you can get on our website, we've got all kinds of resources that you can just download. We've got posters, we've got stickers that can go into bathroom stalls, for example, and they all have the QR codes on them, which normally work. And we've created a few very brief little videos, one for women and one for service providers, that just provide a short orientation. Then we've got some longer webinars on the website for people as well. So I think Sabri has already put the page in that takes you straight to the promo materials that you can use. So with that, I will just say thank you. We have greatly benefited, particularly from the probably thousands of women that we've worked with over the years through our research. And we're just really very grateful for everybody that's contributed to this. So we'd like to turn it over to you and invite your questions, your comments. And again, our apologies that lesson learned, don't invite 300 plus people to try to download at the same time, I guess. So.
Yeah, thank you so much. That was wonderful. And we are so grateful to the enthusiastic participants in this webinar for wanting to join. I think that's what happened, that there were just so many people wanting to look at your beautiful app all at once. So yeah, great job. So I'm sure that the app will be available as in the next few hours. So, but we can jump right into the Q&A. So one of the participants asked, did many of the women who experienced abuse or were survivors, did they help pilot this app?
Yeah, I think maybe I'll start with that. I think as Colleen's pointed out, that over the many years of doing the research that we've done, it has always included women who've experienced violence and qualitative interviews with them. So in some of the early research, for example, that study that I pointed out in the beginning, the majority of women actually were women who had separated from an abusive partner in that first study. So we're hearing lots of spontaneous comments as well about this app from people once they use it, and our email address has been quite active and alive with comments from people who are survivors themselves and have used the app and are sending us comments and feedback that we're acting on as we can.
Thanks. So there's a number of questions about provinces. And so it's great to have the kind of thing around the province, but I guess a couple of the provinces if you're in one province and go to another province, do you have to re-register, or can you look at the different province? And also, if your phone is located in one province, does that mean it automatically puts you in that province? So can you talk a little bit about some of the technical bits around the provinces?
Go ahead, Marilyn.
Okay, I'm taking that. Okay, very good. Confusion on that, sorry. When you first come on and do those onboarding pages that Kelly was showing, you do select your province or territory. So that selection in those onboarding pages with your username and password tells the app that is where you are located. If you wanted to look at the resources for another province, you would have to set up a separate account for a different province. That being said, there isn't anything in the app that is collecting information about where you actually reside. It's not connected to your phone number. In fact, one of the great features about this app is that we don't collect any personal identifiers. That's done on purpose. It's done for privacy and safety. And we don't use GPS tracking or anything of that sort, which sometimes apps will use.
Great. So we had a lot of interest and a lot of messages coming in now from people who downloaded or accessed in advance, and they said they love it. So stay tuned, everybody. But we had a lot of people wanting to know how they can share their agency or the resource that they're a part of, and we had a lot of suggestions in the chat as well. So how can folks do that moving forward?
Sure, I'm happy to take that one, Marilyn and Colleen. So the email that's listed on the webpage for the app on how to contact us, you can email us directly from that, and I'll put that in the chat in a second, and suggest the resource. So we certainly, as we do these webinars, many people do suggest their services or resources within their local province or territory. What I will say is that it was really important for us as a principal that the resources are stable. And so because of that, and because this is our third iteration of an app, we have prioritized federal, national, and provincial territorial level resources over local community resources, only because those tend to be more stable. So there's nothing worse than a woman needing to access a link and it's broken, or it's no longer active, or a name has changed, or something like that. So we are committed to constantly vetting the links and the resources. We have a team that does that, but we try to keep it at those higher level resources, knowing that if you access, for example, Canada 211 or local or a shelter within a province, they know best where the ground resources are, where the actual small community resources are. And so it really acts as a bit of a navigation tool to get you to those more local resources, if that makes sense. So for stability wise, we do the national and the provincial territorial resources.
Thanks, Kelly. It's also just even knowing right now there are more than 500 resources in the app, and just thinking about the job of keeping those up to date and accurate. It's a big job. So.
Yeah, that makes me want to skip to another question, but I won't. I'm going to stick in our order, and I'll ask a little bit about your considerations about different genders experience abuse, or all genders, thinking about whether or not the language is primarily focused on women experienced abuse by men. Is there a way, or is there a thought about expanding to other male survivors or to transgender individuals?
Maybe I'll start and then toss it over to Kelly. I think that's a really important question, and we decided we would like to take the kind of care and focus and evidence base to expand this in other directions. We tried to be very careful, and we consulted quite a bit around women who are in relationship with people of diverse genders. So it's focused on women, but the gender of their partner, we've tried to not make assumptions there and make it as inclusive as possible. But, I'll just hand it over to Kelly to say a bit about men's experiences of violence, maybe.
Yeah, thank you, Colleen. So just picking up from what Colleen said, so the evidence to support the app was really based on women experiencing violence. And as Colleen said, the gender of the partner, we were inclusive with that, but the evidence is around people who identified as women. So it's really important in this work, as you all know, that just switching pronouns is not okay, that we need to pay attention to men's unique experiences or other gender unique experiences around violence. And so that work needs to be done. We're always looking to, future oriented of how we can expand this app out, because it is being well received and being very helpful. And so what might that look like? So I do a lot of work with men experiencing cumulative lifetime violence. And so we're in that phase of trying to understand their unique experiences, how they conceptualize violence, how we measure violence for men, those who identify as male, and also what interventions might be helpful to them. And so taking this app as a template and switching the pronouns will not meet their needs. So we need to do that important base work first, and to do that deep consultation with all interested groups in order to ensure that the app meets their needs and that it is trauma violence informed.
Great. So there were a couple questions that came in about the DA. Can you speak to how it was integrated? Is it the full DA? Is it a suggestion to get to an assessment?
Yeah, so maybe I'll start. It is the danger assessment developed by Dr. Jacqueline Campbell at Johns Hopkins. She is a colleague of ours, and we are using the DA with her permission. The scoring algorithm for the DA is also the algorithm that she developed and uses. Two different algorithms, one for the version of the DA when women have male partners, and for the second version of the DA, which is available when women have female partners. Items, of course, on the two are slightly different. Trying to think what else I was going to say. I think that might answer the question, unless I missed a piece. Colleen, did I miss something?
No, I don't think so, but I did notice that somebody asked about, the training, and, when we work with nurses who are delivering an intervention, of course, those nurses go through that training to use the DA. This isn't certifying anybody to use it. It's embedded as a tool that gives the woman automatic feedback. So you'll see that there's quite a bit of messaging, and we've used this in a number of our studies before.
Great. And I think that clarification around, a survivor or somebody who's experiencing abuse using this tool, and a professional using it with somebody, is a different kind of use of a particular tool. I'm wondering if you might speak to, I know, just because I've known and had conversations with you over time, that it was an enormous amount of work to get this app to the place and to have it available. And Carlene's shaking her head like, I guess some of the questions were around, is there long-term sustainable funding? Any thoughts about the kind of traffic that this might bring? And I know that this is Canada, but other people in different countries might be using this. And any thoughts around where this is going and how this is going to be maintained?
Yeah. So that maybe I'll start and we can pass it over if others have an idea. We do have the funding that we currently have from the Public Health Agency did support development work, but it also supports some of the knowledge mobilization and maintenance work that we need to do for the next several years. A lot of the costs initially are development costs. We haven't factored in our time, which would really greatly increase how much it costs to develop this app, but that's another issue. I think the issue of access to the app, we do track access to the website, for example, so we can see how many people are coming to look at the website. We also track downloads of the app, and like we would know, for example, as of last week, we had just over 3,000 active users since the launch, which would have been the 1st of December. of last year, which is a pretty short period of time. So, and that those users are mostly from Canada, but we do have a significant group of accounts from the US. And that there are people in 48 different countries who've accessed it. Now, we're really clear that it was an app developed for Canadian women using the data that's appropriate for Canada, and that some of the context, it may not be appropriate, but we don't necessarily have any control over people accessing it outside of Canada. That was done intentionally because initially we had a boundary around the app, but people within the country couldn't access it. And so we had to make a decision about whether to keep that boundary up or not. So lots of issues. The sustainability question, it doesn't actually cost that much to maintain it. The big development cost really came initially.
Thanks. I will just add that the web-based version part of the app is back up and running.
Thanks, Kelly.
That's fantastic.
Okay, lots of questions about whether what languages. Someone asked what languages are available. We know it's English and French now, but are there plans or hopes to present it in other languages? Is someone acknowledged that language can be a big barrier to access?
Mm-hmm.
Again, I'll just jump in maybe to start. It's the same with can't just change pronouns. You have to do a cultural translation. And, we've had Francophone partners who've worked really hard on trying to make sure that not just the words are right, but the ideas actually resonate. So we've had requests and, for various languages, but we know that work is serious work that you have to do far more than just a linguistic translation. So please stay tuned or help us find funding.
There's another couple questions that have come in around understanding age, and that the experience of older women is different, and also the experience of post-secondary women is different. Is the app meant to be used for all ages? What kind of considerations have gone into planning in terms of those different ages?
Do you want me to start, Marilyn? Or,
Sure, go ahead.
So just again, I mean, this app is evidence informed. So the research we did looked at women who were 19 years old and older. So it was designed with data, information, and evidence based on 19 years old and older. Not saying that women who are younger than that would benefit from the app, but it wasn't designed or tested with that younger group of women. So I hope that answers the question.
Yeah. However,
sorry, Marilyn, I just wanted to add that we tried to ensure that we had visuals, for example, that are not just focused on women of a certain age group, that we try to encompass a wide range of styles and ages and so on.
And again, the research wasn't done with younger women, but there have been other studies done testing apps that have some similarities to this that have been done with younger women and show the same types of benefits that we saw in our early work. And we have certainly received feedback from, say, university or college age women that they really like the app. They find it to be really accessible and user friendly, and with lots of good information that they think is a good fit for them.
Okay, I think we have time for a couple more. So someone said, I noticed the pillar regarding claiming your power. In this pillar, is there an opportunity for survivors or app users to learn about advocacy opportunities and organizations, or options to become involved in the movement to end GBV or IPV?
Yeah, currently there's not, but what a great idea. So this is one of the reasons for, trying to have these talks and sort of two-way conversations with all of you, because you know, that intention, so many women we know in our work, and you would know in your work too, when they've experienced violence, many of them are wanting to give back in some way to other women to make things better. And I think that actually is a great suggestion to be able to think about. We have complete control over our content and control over the resources through a content management system. So we can, in fact, continue to update content fairly easily. So thank you so much for asking that question.
Well, Marilyn, I'm not sure you should have given that answer, because now I've got another question about the kinds of resources. You know, one of the things that I think is great is this audience has so many different thoughts about the kind of resources and services that people might need. And one of the other questions that has come in is around whether or not you consider adding in resources, prevention supports for people who are perpetrators to prevent them from perpetrating, or links to those kinds of services.
I'll just jump in to say I don't think we have the expertise and the evidence to do that. Yeah, I think that is, and I don't think that there is. We've learned from women that sometimes the line gets drawn very, very firmly between perpetration and victimization. And women have asked us for support around when they perceive that they have been perpetrating violence. But I would just say that, at least speaking for myself, I don't have that expertise at this point, and I'm a bit old to gather it now.
I just want to say thank you so much to all of you for this presentation. It has been fantastic to be able to see this work. I'm very excited, and I think I'll speak to everybody, excited about what is now available and what is to come in terms of ongoing support and resources and understanding about the use and value of this tool in Canada. So thank you very much for your presentation.
Thank you. Thank you for hosting us.